My name is Dr. Nambassa, and I'll be presenting with Dr. Nalukwago on priority number 4. And for priority number 4, we are saying that as the National Unity Platform, one of the things that we are going to put emphasis on is access to quality public services. When we talk about public services, we are talking health, we are talking education, we are talking clean water, we are talking transport, we are talking infrastructure. When we look at our health system at the moment, you'll find that out of all the districts in Uganda, about 82 districts lack a general public hospital. Ladies and gentlemen, we are saying that out of 2,100 plus sub-counties in this country, over 1,696 lack a health center for. If we have all those districts that do not have health centers, where are our people going to go when they fall sick? Recently, we saw Chris Bariomusi fall sick in his own constituency, but there wasn't a single hospital that could attend to him. He had to send for a helicopter to come and airlift him from his constituency, from the people that he represents, to be treated in a different districts where they also have their own MP. But I ask you Ugandans, how many of you have a contact that you can call for you to get a helicopter to airlift you from wherever you are? I think out of all of us here, it could only be Mr. President, but I'm not sure. I think we also can't get a helicopter. So how many people are dying on a daily because they don't have access to good health care? When we speak about good health care, people believe that we are only speaking because we are privileged. I speak from the profession because I am one of them. I have served in those hospitals. I have been to Chirudu Dialysis Center, but I tell you that people fight for beds for them to be able to get dialysis. But I saw a photo of a certain country where a dog was getting dialysis. Our lives less important compared to the dogs that the whites own. We have seen pictures of babies at Kawempe Regional Referral Hospitals in these plastic chairs where you're seated today. Ladies and gentlemen, we lose over 100 mothers on a daily. It's sickening that as I hold this microphone, in this very minute that I'm speaking, there is a woman out there that is bleeding to death because there is no tranexamic acid, because they couldn't get oxytocin. Sorry, I'm going very far. Let me go to education, ladies and gentlemen. You see, in Uganda, over 1 million children that enroll in primary 1, only about 300,000 make it to primary 7. That is only about how many? 30%? Do you see what I'm saying? Where are these children going that are dropping out? Who is thinking about those very children? They are out there getting pregnant if they're ladies, or if it is a gentleman, he's now going into stealing. And these children are giving birth not to children, but to more poverty, because in the first reason they dropped out, it was because of poverty. Ladies and gentlemen, we find that there are districts, for example, in a park, where the gentleman with the big heart claims to get 100%, but there is no single secondary school. Are you hearing me? Am I communicating, ladies and gentlemen? As we go ahead, we find that in the education sector, a single pupil is only allocated 20,000 for school fees in an entire year, while we see the Speaker's office getting billions for donations. We see so many spending a lot of money, in different things. They're giving out, they're dashing out money, but your child is allocated only 20,000 for them to be able to study for an entire year. I don't know what for. Ladies and gentlemen, when we speak about clean water, I've been to districts where people share water sources with cows. We find that cows are even getting some clean water, but there are districts where they do not get clean water. Out of the 48 million Ugandans here, we find that about 38 million lack access to clean water and to toilets. Where are they putting their stool? Where are they defecating, ladies and gentlemen? There are those little errors that we find where we pass. We find there is a heat because they don't have access to clean water, and it trickles down to the health system. Ladies and gentlemen, the National Unity Platform promises to offer access to good roads. we find that out of the 1,500 plus roads that we have, I think it's 153,000 kilometers worth of road network, only about 6,338 kilometers are paved. That is only about 3.9% of the total road network in Uganda. But even out of that 3.9%, 20% is in good conditions. We have seen the roads that you use. We did the pothole exhibition. Ladies and gentlemen, you saw that we have lakes in the middle of roads. When we speak about our railway system, we don't even have a gauged railway system. That out of the entire railway system, only about 321 kilometers are operational. And from where we saw videos of our own train moving backwards, and everyone was saying, where is it going? But we know that in developed countries, trains are the quickest and easiest means of transport that they actually use. Trains can improve our road transport. Trains can be used to carry out trade from region to region, but that is not what we see in the current Uganda. Ladies and gentlemen, when we study about the history of Africa, Uganda, when we constructed Entebbe International Airport, it was the largest international airport in East Africa. And that was before Mr. Museveni took over power. He takes over power 40 years down the road, and Entebbe International Airport is the only airport that we have. Yet it was the biggest in East Africa. We now admire Kenya, we admire Tanzania, but I mean, what are they doing? I had forgotten to tell you that when Magufuli took over power, he paved over 5,000 roads in 5 years. 5,000 kilometers of roads in 5 years, and Mr. Museveni has done that in 40 years. What more evidence do you need for you to say that it is now for us to have a new and better Uganda?
People power. Dr. Nalukwago nzize kubabuulira mu Luganda so that bajjajja bange ab'emasaka wakigundu bategeere n'ab'emawokota ab'emikono muliyo wesiibye mutana mulina okutegeera. Bannange Dr. Shanema annyonnyodde mu Luzungu naye katuddeko mu Luganda. Ngenda kwanguyizaako kubanga obudde butukutte. Public service mu Uganda population yaffe eri miliyoni 48. Nga tugenze maaso tuprojectinze mu mwaka 2026 population ya Uganda egenda efuuke miliyoni 16. Ne kwezo miliyoni 16 abasinga kwabo ebitundu 10 bagenda kubeera bakozi. Kitegeeza Uganda oba government erina okwetegekera ekiseera ekyo. Bwe tukyetegekera tetugenda ku developinga. China yetegekera ekiseera ekyo. Singapore yakyetegekera ndowooza mulaba gye bali. So nga ntandika mu public service tulinayo ebyobulamu, ebyenjigiriza, amaanyi g'amasannyalaze, amazzi amayonjo. Tulinayo enguudo, tulinayo eggaali z'omukka, tulinayo ebisaawe by'ennyonyi. Tugamba tuliwa nga Uganda biseera bino. Mu Uganda tulinayo districts 82 ezitalina malwaliro. Ate nga tulina ne sub-counties tezirina health center 3s. Bannange health center 3s wewatandikira obujjanjabi mu system ya health mu Uganda. Naye ebyalo oba sub-counties amagombolola 1,600 tegalina health center 3s. Kamba buliyo ka story twawaddeyo batugenda nga tuva Emityana tugenda Ekyankwanzi ku campaign tour ya president. Netusanga health center 3 nensalawo okukikozesa okweyamba. Unfortunately yabadde abandoned. Tebuli basawo n'abalwadde bali awo tebalina abakolako. When nageze mu toilet okumanya zibadde abandoned. Nasanze nnyo ennumba Mr. President ennumba nezinnuma. Ennaku 3 badde siri campaign trail kubanga mbadde ngezaako okuwona. Naye ebyo bye twagala okukolako nti tewali health center 3 mu government ya His Excellency Robert Kyagulanyi Ssentamu ejja kubeera abandoned. Nga tugenda maaso Mwami Museveni alina emmotoka ezimutambuza 600. Si 600 wabula 600. Naye mu Uganda yonna tulina ambulances 178. Bonna Uganda lwaki gavumenti eno tesobolako? Bino bye twagala okukyusa. Nga tugendako mu bya enjigiriza. Ndi musanyufu nti nze nzaaliddwa basomesa era nasomera ku ssomero lya UPE so mmanyi ekiriyo ate nga bazadde bange bakolanga lesson plans nga nange ndaba kirabeka kyeva bazaala omuwala omugezi naye tugende mu maaso mu byenjigiriza netukiriza omwana oba buli mwana mu Uganda bamuwa $2,000 buli mwaka. $2,000 buli mwaka kisobola kukola kibana Uganda. $2,000 tekisobola kugula na kalaamu oba kugula peeni mu mwaka oba mu ttaamu egi oyo mwana nasobola okusoma. Mu gavumenti ya Kyagulanyi tugenda kwongeza funding mu UPE schools. Ekirala ekisinga obukulu bano abaana bagenda ku ssomero bambi ne bamala essaawa 8 nga tebalina kye balidde. Tetugenda kukkiriza ebyo mu gavumenti ya Kyagulanyi. Mu gavumenti ya Kyagulanyi buli mwana ajja kufuna emirimu at least emu buli lunaku basobola okonsentratinga mu kusoma kwabwe. Ekirala abasomesa beekalakaasa. Ekisooka tebamala kubanga bw'otunuulira staffing rate y'amasomero mu Uganda gali ku 34%. N'obutamala abasomesa era nze mama wange yasomesanga mu ssomero lya gavumenti naye ng'asomesa subjects 3. Lwaki omusomesa omu bamubadde ninga okusomesa subjects 3? Buli subject erina okubeera n'omusomesa. N'ekirala abasomesa tebabasasudde bulungi. Kyobola beekalakaasa mu Uganda empya tewajja kubeerawo kwekalakaasa kuba wajja kubeera ne ssente ezimala era tujja basasula bulungi. Bwe tugenda ku kyamazzi baganda bange abasinga mulwala typhoid temumanyi bino ebintu gye biva kubanga bannayuganda abasinga tebalina mazzi mayonjo kyokka nga tulina agayanja ga Nalubaale tulina Kyoga byonna tubirina mu Uganda naye ensinga zi Saudi Arabia ezitalina nnyanja zirina amazzi amalungi ageyagaza naye wano mu Uganda tetugalina. Lwaki tubeera mu gavumenti bwetyo? Ne tugenda ku amasomero ebitundu 68 ku 100 tebirina mazzi. Amalwaliro ebitundu 44 ku 100 tebirina mazzi. Lwaki eddwaliro libeerawo nga terina mazzi? Bwe tugenda ku bya enguudo Dr. Shamemba agambye nti tulina network y'enguudo omutwalo 15 nekwate emitwalo 15 kilometers nkakaaga zokka zenkole ate nga NRM yakakolako kilometers 4,000. Imagine emyaka 4 kitegeeza buli mwaka bakola kilomita 10. Incompetence of this government. Tetugenda kujjukiriza mu gavumenti empya oba mu Uganda empya. Nga tugenda maaso nti railway abasinga ddala bazadde baffe abasingako obukulu bazadde bano batambuliranga mu gaali y'omukka naye kati nze emyaka gyange okulaba ku gaali y'omukka ninagenda bweru wa Uganda tekigenda kubeera mu gavumenti ya Kyagulanyi. Ebyo byonna tugenda bituusa mufune gaali y'omukka ng'osobola okubeera wano e Kampala yobanayo omupiira mu Kalima City ng'olinya high speed train etwala ddakiika 3 watuuse dda walabye omupiira wakomyewo. Uganda empya tetubasuubiza. Ekirala era ebiddiridde okusemba amasanyalaze n'amazzi. Amasanyalaze ga bbeeyi. Uniti y'amasanyalaze ya $1,000. Ngenda mu saluuni okunsiba enviiri okunnaaza bunaaza omuviiri omukyala wa saluuni nagamba maama amasanyalaze ga bbeeyi nange nina okuggyako ssente nnyingi naye nga lwaki mbeera nsiba enviiri eza ssente nnyingi nga lwaki gavumenti ya Kyagulanyi tejja uniti y'amasanyalaze ku $1,000 n'ebiteeka ku $500. Ekidomola ky'amazzi tugenda kukijja ku nnusu 120 tukiteeke ku nnusu 10. Bannayuganda mugenda kunywa Uganda empya. Ate nga nokolekitinga amazzi n'amasanyalaze bigenda kubeera byabwerere gavumenti enigenda gikolako. Ekisinga obukulu airport. Mukimanyi loopu waffe ng'akyakulira Kosase yavaayo n'abalaga nti mwezo waliyo abakyala bataasoma ne baweeta emirimu. Abataasoma bonna tugenda bagobayo kale baasoma omutigi naye biri ebitabo byetwogerako bonna bataasoma tugenda bagobayo tuteekeye abantu abasobola okumanaginga air transport yaffe so that buli region wabeereyo airport nga munnayuganda asobola okubuuka n'avaano nga bwekiri e Kenya ababaddeko e Kenya mukimanyi abantu bavuga okuva e Mombasa ne bagenda e Nairobi ate a low cost byebyo twagala mu Uganda empya. Bannayuganda nga mmaliriza mukimanyi tubyogeddeko sente za health zigenda kwongezebwa tugenda kwongeza sente funding mu government hospitals ate n'abaana baffe bajja kulyanga emmere y'obwerere buli lunaku. Neyanzisa nnyo people power our power.
Thank you so much, Dr. Judith. In conclusion, here's what the New Uganda promises. With the National Unity Platform, we are saying that our health centers are going to be increased. We are going to increase funding in the healthcare system to about 25%. or even more, considering what was promised in the Abuja Declaration that said if the health system must improve, at least 16% of the national budget must be dedicated to the health system. We are going to recruit doctors 16 times more than what we have at present. And we are saying that every health center 3 must have a doctor. And we are going to triple other healthcare workers in the new Uganda. In the new Uganda, the funding for the education sector is going to be increased. We are saying, why should our teachers be struggling? Yet we have a lot of money. We have over 10 trillion that is falling to corruption every year, but our teachers do not have enough salary. We are saying that connection to the national grid for electricity is going to be free of charge. Ladies and gentlemen, you do not have to buy electricity poles anymore. You do not have to pay for the wires to have electricity in your homes. We are going to remove value-added tax on electricity bills. We are going to make sure that businesses and domestic users of electricity, where SMEs fall, do not have to pay VAT. Ladies and gentlemen, we are going to make sure that every village has 10 water sources, clean water sources, and all town councils and municipal councils must construct toilets that will be accessed for free, ladies and gentlemen. I feel so bad when I go to Kampala and I have to look for a toilet and I pay it, it is even dirty, but they are going to be free of charge in the new Uganda. Ladies and gentlemen, we are going to have a railway that connects all the 4 regions in Uganda. Why should it take you 8 hours, 12 hours to come from here to Yumbe, yet you can use a train and get there in 4 hours? Ladies and gentlemen, we are going to make sure that we have regional, international airports. These entire airports that you see, we are going to put down and we lift very new, good-looking international airports. And there is no reason why you'll have to come from Ntungamo to Entebbe to board a plane to Rwanda. Do you understand? That is what we are saying. We are saying that in the new Uganda, you will not have to struggle for anything. We shall make sure that whatever it is that you need as a public service is available to you. People power. Our power.